Red Deer, Alberta, I'm Kirsten McCrae.
And I'm Shelby Hunt. Today the hot topic for Health Matters is iron deficiency anemia.
Anyone feeling tired, having frequent headaches, experiencing shortness of breath, or have noticed that you look a little bit pale?
Well, you guys, you may have iron deficiency anemia.
Anemia is a condition in which there is a deficiency of red blood cells or hemoglobin in the blood, resulting in these symptoms.
Iron deficiency is a common worldwide cause of anemia affecting persons of all ages. The anemia results from dietary deficiency, growth spurts, pregnancy, loss of iron through bleeding, or increased demands.
Heavy menstrual periods are the most common cause of lack of iron in women, and the amounts of iron eaten may not be sufficient enough to replenish the iron that is being lost each month due to the menstrual cycle, therefore contributing to the symptoms of the disorder.
Anemia is common in pregnant women because a growing baby needs iron and will take the iron from the mother.
Several conditions of the gastrointestinal tract can lead to bleeding. In some situations, this can be sudden, for example, after a duodenal ulcer or vomiting, and this bleeding can be seen in large quantities pass through the feces. However, there are also occasions where the bleeding is not so obvious and a constant trickle of blood into the gastrointestinal tract goes unnoticed when passed through the feces.
Although this may seem difficult to believe, some medications can actually cause the bleeding, for example, aspirin. Hemoglobin is a protein in your red blood cells that carries oxygen from your lungs to the rest of your body. Anemia can starve your body from the oxygen it needs to survive.
Since the protein hemoglobin is reduced, homeostasis in the body will be disrupted due to the fact that if you have a reduced oxygen carrying capacity, you do not have enough hemoglobin to carry oxygen, which leads to the many symptoms of anemia.
In red blood cells, there is an important component which is hemoglobin, the protein. Heme, made of iron, and globin, meaning protein. Since iron is a part of the hemoglobin molecule, when there is an iron deficiency, the hemoglobin molecule is missing a part, therefore cannot carry the oxygen required.
But wait, maybe should we back up just a bit? For all you viewers who may be a bit confused, here's an example of how a body without anemia functions. When there is an inadequate amount of oxygen delivery in the body due to a decreased red blood cell count, decreased amount of hemoglobin, or a decreased availability of oxygen, the kidney and liver respond through the release of a hormone, erythropoietin, which stimulates the red bone marrow to produce red blood cells. The enhanced erythropoiesis therefore increases the oxygen carrying ability of the blood.
This process must look different in someone suffering from iron deficiency anemia, though. In an anemic person, proper erythropoiesis cannot occur due to an inefficiency of iron and vitamin B12, therefore offsetting the production of viable red blood cells and results in the incompletion of the negative feedback loop. So how then is iron deficiency diagnosed?
Well, when you go to your healthcare professional, a detailed health history should be obtained, including information about your diet to identify your poor iron intake. A medical history should also be taken to determine, for example, if there is any family history of iron deficiency anemia. A physical exam should then be undertaken. The most common way to diagnose iron deficiency anemia is through a full blood count as well as a blood smear.
If your healthcare professional confirms your diagnosis of iron deficiency anemia, there are many options for you to increase your iron, therefore treating the disease. For most people with iron deficiency anemia, the aim of treatment should be to restore hemoglobin concentrations and red blood cell levels to normal and to replenish iron stores. Iron deficiency should be treated with oral iron therapy, and the underlying cause should be corrected, so the deficiency does not reappear. Where the cause cannot be identified or corrected, the person may have to receive supplemental iron on an ongoing basis. For example, this one.
Aside from supplements, individuals diagnosed with iron deficiency anemia may also be encouraged to include food products such as dried apricots, oatmeal, spinach, pine nuts, beans, and iron-fortified breads and cereals. These foods are high in iron and could be consumed in combination with the supplemental therapy. Well, folks, that's all for today. Thanks for tuning in to RDC Health Matters Hot Topic Tuesday.
And back to you, Jim, for the weather.